I can change my face, I can touch abilities. Just like, I'm just like you, I'm just like, I guess you're no more.
We're starting a brand new surgical practice. It's in a great location and it's a very exciting place to be.
Love that.
Yeah, that's my favorite. I'm so glad that I decided to get that thing. It's going to take a lot of hard work to get started. Right now, I think this is a great place for me to be.
My name is Melissa, and this is my sister Vanessa. We both came in today to see Dr. Edwin. We were both planning on having liposuction. We've actually been, trying to lose weight, but there's like certain areas where you just can't get rid of. And, I'd rather not spend my whole life at the gym, so we just decided on doing it.
But go hide. Vanessa and Melissa, they are not only sisters, but they almost act like twins. Their body frame is the same. They wear the same clothing. They actually have the same mannerisms. So I think that's why they're doing this together. Hi, girls. Hi. How are you this morning?
Good, and you?
Good. So the liposuction duo, huh?
Yes.
Okay. We're going to start with you, Vanessa. Okay. Now, the last time we talked, you wanted to make sure that you keep the hips, right? You like that. The Latino culture, it's very sexy to have a little tiny waist, but still have your hips, and that's what Vanessa wants to maintain. And you want to keep this?
Yeah.
Okay, just double checking on everything. It's very different from what a lot of women in LA are asking because it's our hips that we're taking off these days. Let's take a look at the areas that you were talking to me about. Let's see.
I have a bulge right here on the side.
So you're talking about this right here and then right here where your hips are?
Yes.
Okay. So that's considered abdomen and flanks on that side. No matter how close sisters are, there is an entity that they're always going to be competitive.
Okay.
Are you guys thinking about having it on the same day?
Yes.
Oh, who's going to take care of you?
Each other.
You're kidding.
My mom.
Oh, that's sweet. Okay.
Yeah.
Awesome.
I'm gonna get liposuction. My sister is great. We do everything together. I wish she was doing this with me, but unfortunately she's not.
I was gonna have the surgery with her the same day, but I really didn't have any money saved up, so I would have wanted to share the same experience at the same time. It would have been cool, but I believe it's about $4,500 for the first area and then $1,500 each additional area. So depending on how many areas you want to get rid of, that's how much you should save.
You nervous?
I don't like surgeries at all, but I have to support her.
Good morning. Maybe take a little bit of this right here.
Oh yeah, anywhere you see her.
Anywhere.
Take it out.
Okay. She has a lot of abdominal fat, so we're going to do liposuction there and also on the sides to kind of contour her body so she has a lot more of a waistline.
Do Jessica Rabbit.
Draw all the way around. What did you say, Jessica Rabbit? Oh, okay. She had talked about a Jessica Rabbit body or a Coca-Cola body. What that tells me is she really just pretty much wants a nice waist, so we're going to really kind of take her in the middle. So she's all marked up, ready to go.
Okay. Okay, bye.
Go to sleep, dear.
I can't go.
Alright. I can my face.
I hope the surgery is going to give me the perfect body that I've always wanted.
I can be just like you. I'm just like
Beanbag action? Awesome. Vanessa is 23 years old, so she's really fibrous, so she didn't have as much fat as she probably thinks she does. Anytime you're doing liposuction, it's not necessarily pounds lost, but it's more contouring of the way your body looks and the way your clothes fit.
My mom and I were waiting for my sister. We're a little bit nervous, anxious.
I still have a little anxiety in my stomach. I think until she's out, I'll be okay.
We completed the abdominal area. We're just concentrating on the sides, and this is to really bring in the contour of her body so she gets a lot more of a waistline here. Almost done. Good. Okay. Thank you. Hello, Melissa and Mom. Now you can take a deep breath and exhale. We got about 3,300 cc's.
Really?
Yeah. The nice Jessica Rabbit start, so she's gonna be really happy.
I know how she feels. I just don't want her to feel pain. Like, let me give you some medicine now.
My sister's been doing everything for me, so I'm a little princess right now.
Vanessa. Hi.
How are you?
Good. How are you?
I'm good, man.
Miss Vanessa. Hi. How are you?
Good. How are you?
I hurt when I do that?
Yeah.
This area around your belly button is the most tender area.
Oh, okay.
You can get like a brand new tennis ball and just kind of roll it.
I feel great. The results are wonderful. I never thought I'd actually have the flat stomach that I wanted to have for a long time.
Probably in the next couple of weeks you'll see yourself swelling, and then it finally goes down as the month goes by.
I definitely feel sexier. Hopefully by the end of this month I should have the full Coca-Cola body.
All right. Call me if you need. Other than that, you look great, okay? Say hi to Melissa.
I sure will.
Do I think Melissa's jealous of Vanessa's surgery? I think she is a little bit jealous. In fact, I bumped into Melissa the other day, and she says, "Oh, I'm so jealous, but I can't wait to get mine."
Yeah, I look at her stomach and I'm like, oh my God, it's like a cardboard, you know? And I look at mine and I'll have it done hopefully the beginning of next year. I'll be slim and sexy like her. I am a little bummed out that my sister Melissa wasn't able to get the surgery done, but I think it was better that she didn't because I needed help. I really did, and she was there for me 100%. She even took a few days off.
I had the Coca-Cola body that I wanted. I feel like I have the curves in the right place. So no more love handles.
You look so good though.
Yeah.
I'm so jealous.
You can wear your pants now.
I know. that's oh look. That's the part I don't want. I know.
I can my face.
Vladimir? Go ahead and have a seat. Hi, Vladka. I've known Vladka for about 3.5 years. We met at my previous practice where she was a massage therapist and she took care of a lot of my patients post-operatively.
When I look at the mirror, I see myself older than I feel. The worst part is my neck. I don't like my neck and chin. I hope that the plastic surgery will make me look younger.
So we had talked about a neck lift and lifting up this area and pulling back a little bit on the skin.
Yes.
Vladka started talking to me about plastic surgery almost 2.5 years ago. I want to move you to one of the other rooms and you can ask questions. In the 80s, her and her husband had defected from Czechoslovakia and moved here to the United States. You're going to look in the mirror and show me what bothers you.
This neck stands to really be very soft. And then these little jewels here.
When someone points to their neck and says they want to get rid of this is really mostly her neck and not her face. Vladka will probably need a facelift later on, but I think she has a lot of years left before she really does need that. I'm starting to see a little bit of jowling right here. This is pretty much where you're showing a little bit more age as opposed to when you're looking at your total face. What that would entail is a tiny incision right underneath. She has a lot of extra skin here, so we're going to take a lot of this extra skin and just move it back and tuck it back right here so she has a nice clean angle right here. That's going to allow us to take all this and move it up this way.
Okay.
It's not going to be a full facelift, but it just will be a little bit of tightening to that area. I think it would be a lot nicer.
That would be wonderful. Yeah. I would like to look younger. Younger, yes, I don't feel old, so I don't want to look old too.
Neck lift.
I'm going to have my neck lift, and I'm nervous about the anesthesia and the pain after, but I know I am in good hands. I didn't tell my boyfriend to have my surgery. I didn't want to scare him too, and I didn't want him to talk me out of it.
Good morning, Vladka. How are you?
Fine.
Did you have a good night's sleep?
I didn't sleep long, but it was good.
Yeah. It's always normal in surgery for the first time to be scared. Vladka is the great can for this procedure because she is concentrating on this portion of the neck. I want you to go like this, like that. She kept addressing her neck is the area that we're going to concentrate most at rejuvenation. Okay,
Good.
it's good.
Thank you.
This is the time to make up a dream. You're gonna start to feel sleepy.
I can my face. I'm just like you, I'm just like
The procedure that Vladka is getting done is a neck lift. Well, what we anticipate is basically lifting up her neck. She wants to address the skin. She has a lot of hanging skin, so pretty much rejuvenate what we call the lower third of her face. We're going to do a little bit of liposuction to the neck to contour the neck area. The worst case scenario when you're doing a neck lift is there's some big vessels that run within the planes that you're at, and you need to make sure that you are cognizant of that, otherwise you can have a bleeding problem on your hands. Okay, we're going to elevate this flap so we'll have a lot of skin to lift up and drape. One of the biggest risks is a hematoma, which is bleeding. Anytime we see a drop of blood, we're going to be on it, we'll get it before it gets us, basically. Now, some people have a little bit of a waddle underneath their neck. Yeah. What you do is you just get that little bit that's bulging out. You don't want to take too much, because then she gets pretty hollowed out. Then we're just going to pull this back and trim the skin, and then we're all set. She wanted something very natural, so trying to keep it all the way back in the hairlines. So that would be nice if we could achieve that. Kind of push this here. Exactly. Okay. When you're in the operating room, you as a physician are ultimately responsible that they have a successful outcome, and to make sure that when you're finished with the procedure, it looks the way you want it, because if you don't correct it beforehand, it's never going to be right after. Okay.
Very nice.
Thank you, guys. Vladka. Hi. Your surgery went very well.
Good.
I know it's going to feel very tight around here. That's probably what you're feeling. How do you feel? How's your pain?
it's there.
It's there? As at least controlled with what they're giving you? Okay. All right. All right. Bye.
I can my face.
I had the surgery done yesterday morning. I think it's still the anesthesia in my body.
Hi, Vladka. How are you?
Sleepy.
Well, your surgery went a little bit longer than expected, because we really wanted to pull your skin up. Initially, since there's been so much gauze around the area, you're going to notice a little bit of rippling. You see it on your face. When I looked at her initially, she's really swollen around the face, but that's expected because all this pressure is kind of pushing the fluid forward. Now, granted, you're still swollen. She's a little bit cautious about looking at herself. You like your new hairdo, right? Okay. This is a chin bandage. Vladka is the ideal patient in recovery because in her work, she takes care of patients post-operatively for plastic surgeons. Give me a call if you have any questions. Okay, great.
Thank you.
You're welcome.
The surgery was done 1 month ago.
I'm good.
Oh my goodness. I'm doing good. How are you doing?
Still the swollenness, right?
Yeah, I think it's swelling. That is going to come down. Yeah. What you should do is just massage this right here.
Yeah.
Your neck looks pretty good, It's just these little things.
Perfect.
Vladka's result, I am very happy with. I think she is very happy with it also. But it's pretty good.
Great.
You happy?
Thank you very much.
Oh, you're welcome.
Today I feel wonderful and happy that it's over and it looks really good. I like it because it's very settled and natural. I have better self-confidence now. I am 52 and I hope that I look like in my 40s. I am happy that I look younger.
Vladka feels like she looks 20 years younger. The most I want to achieve is looking at least 10 years younger, so I guess she's really happy.
I know that I will need more to be done.
I can my face.
Timothy and I have been together for about 4 years. We are in our first year of marriage. You got fresh squeezed orange juice. Today I'm going to Malibu. I'm going to my mother-in-law's house. We're going to do a little Botox party for colleagues. Hello. Hi, honey. Hi. I couldn't ask for a better mother-in-law, and we're fast-growing best of friends.
When Timmy brought her home, I found out not only was she beautiful inside and out, but she was a plastic surgeon, and I said, thank you, God.
Hey, girl.
Welcome to our Botox party.
It'd be nice to bring a little bit of that corner up. It's a little bit more youthful. You frown like you're angry? It's really about trying to get into that belly of the muscle. Okay, put some pressure right. It stings a little.
Just think how beautiful you're going to look, Gail.
I'm going to give you a little bit of a break. Okay?
Yeah.
She's crying. Okay. When you do these Botox parties, you're able to chat with the women a lot more candidly than having them come in a really formal setting into the office. I'm all sweaty. And it allows them to be a little bit more relaxed about questions that they might not feel comfortable asking me in the office. Frown like you're angry? Yes, I am one of the Botox followers. I get it right here in between my eyebrows.
I think it looks great. I didn't have Botox today because I'm going to have plastic surgery with Julie.
I think you're going to look fabulous.
We're going to be using Carol as an example.
Yay!
I can my face.
My name is Carol, and I can't believe how old I look. As I get older, everything's dropping.
Carol, and this is Julie's office.
Julie!
Hey, how are you?
I'm good, baby.
I'm so glad you're here. Good. Finally, right?
Oh, yes.
What surgeries have you had?
I did facial work when I was 50.
My mother-in-law, Carol, has already had a facelift, but now she wants a fresher look.
In the sunshine, every wrinkle shows. I don't think there's any chance in hell I'll ever look like I'm 20 again. But there are things I want changed. My husband passed away in November. We've been happily together for 30 years. It's not going to make a difference in his being gone, of course, but as he told me, please, you may have 30 more years to go. You've got to live life. This is it. I'm going to do it this time, and then you can put me in the ground.
To operate on my mother-in-law is going to cause a little bit of, actually a lot of pressure. I want to give you a natural look. Obviously, I'm not going to pull you so you look like half those women walking around, you know. This is something that's going to be part of my life. You know, I see her quite often, so the result has to be great.
And then you get to look at your beautiful work every day.
So I better do a good job, right?
Yes, great. I'm excited.
All right, baby.
Bye. See ya. I was quite nervous the morning of surgery.
Leading up to the actual surgery, multiple calls from my sister and brother, worried, about mom going under.
Christy is her daughter. Christy and Carol went in a lot earlier than I did because I wanted to separate myself a little bit and concentrate on being a surgeon instead of so much a daughter-in-law.
The only thing that I have any concern about anytime anybody goes under, that's the only fear that you have.
Yeah, that's a tremendous amount of pressure.
Considering that I have these 3 kids that are extremely close, extremely tight, and their mom is like, we're very protective of her. How are you?
I'm good. Deep breaths. But I'm fine. She commented to me that she says, you look more nervous than I am. Of course, anytime it becomes a family member, it's very near and dear to your heart. So you're not just in this doctor mode where you're really just going to take care of the patient, do the best you can. There's an emotional component that you have to deal with. This surgery is very exciting. It's extremely challenging, technically very difficult. Can you do me a favor? Push my glasses up a little. I think it's my glasses that are falling. That's good. That's good, yeah.
I can my face.
First, I dissected it so it's free and mobile. Then we had to go into a deeper area, and that's the deep tissue to really pull this deep tissue up, because this is what was kind of dropping. Then redrape the skin over the area, and the same thing goes for the neck. Hey, well, I just entered the deep, and so I'm basically
So you just do
underneath.
sort of a couple centimeters beyond, and then you just go into the... Well, there is a downside to operating on family. They're always going to have questions. If there's a problem, then there's a real downside. So you just have to be really confident about your abilities to do it.
I forgot to tell you, any time during the case, if her face starts twitching, can you just tell me? Oh, sure. It means I'm just within the nerves. The greatest danger that a surgery like this poses for Carol is, 1, first, nerve damage to her face, and 2, it's a long case, and you just want to make sure it's safe and you stay within a normal anesthetic time for her. Send, please. I was a little nervous the whole case. Not nervous as far as skill, but just nervous because there's my mother-in-law. I don't want to go too tight on this.
No. Take some deep breaths. Open your eyes.
My biggest concern is, because we went into that plane where we talked about the nerves, was how are the nerves doing? Yeah. I know I irrigated out also. Not so she's talking and rocking while I feel like a sigh of relief. How about that?
Well.
I'm right here, Carol. Tell her I'm right here. How's your pain? So my biggest concern is, because we went into that plane where we talked about the nerves, was how are the nerves doing? You just have to see their face move before you can actually relax. Hey, Carol, can you show me your teeth? A big, wide smile? Good. Blow like you're going to kiss. Perfect. Good. That was just checking some things. And her face is moving beautifully, so in a sense, you can just go, exhale and just finally just relax and say, okay, good.
I was so worried about both of you guys all day.
It was long. It went pretty well. And her face is moving and everything. Remember, you were asking me about that, and so.
Yeah.
Carol's gonna go home with me tonight. She's going to stay in our guest room, and her daughter's also gonna stay over. So we're all kind of gonna be watching over her tonight.
Oh my God. I'm sorry. I hate this damn thing around my neck. When do I get out of all of
That's
this?
what she keeps asking me. She wants to know when this stuff comes off.
Oh, a few days.
I forgot to tell you I'm claustrophobic.
She has claustrophobia, which I never knew about.
Just relax, Mom.
And we had wrapped her in this pretty much a cocoon-like dressing. And between the anesthesia wearing off and her feeling claustrophobic, she really was not comfortable with all this pressure around her face.
Okay for her eyes? Great.
Let's caravan.
Okay, well, so then we'll all caravan together. We had taken different cars, and they decided Tim would drive her home. So if anything was to happen, he would be taking care of it.
Please don't put your hands under there.
But this hurt. My stitches hurt.
Don't touch it.
Right under my chin. I'm not joking.
All right, well, don't pick at it, and I'll pull over and ask her.
Jim, get off the roof.
Jules? She's asking me to, like, pull over because I think she's just feeling a little claustrophobic.
Timmy,
Stop. What?
God damn it!
Don't take it off. I'm calling my wife right now.
No. Go get the guys. They gotta...
What? Stop! Don't pull on
Timmy!
I can my face.
Timmy,
Stop.
I have Medicare.
On the way home, Carol had a panic attack.
Oh, no. Go get the guys.
I had to go out to the hospital parking lot. Feel better?
Yeah.
I loosened up the garment a little bit and just kind of calmed her down.
Look,
We just put her in bed, and she's finally starting to relax. Normally, Carol is so laid back. She's loving, she's sweet.
Can she lay just
I
a
don't
tiny-
feel sturdy.
A lot of it was the post-anesthesia. It puts you off balance, and her personality just really wasn't there.
Though I want my neck open. I thought my face was swelling and that it would shut up the airways.
Yeah.
Do you need it to be cut?
No, I want it off.
Well, I'm just going to, for now, just cut this thing right here.
Oh, okay.
The bandage pretty much holds down the pressure. It helps hold the swelling down, and if we take it off, she's just going to swell. I'm going to leave this on for a little bit, and we're just going to watch you for a little bit. And then we'll reevaluate this whole thing on your neck in a second.
The surgery went good?
Yeah, the surgery was long. It went pretty good, though. I didn't know she was claustrophobic.
Stop! Don't pull on it.
I mean, I had no idea. Usually I ask beforehand, but, just sort of slipped my mind because I've never just seen her do that. And so we had to take the dressing off, and we have this little elastic bandage, and she's much happier with that. How are you? Carol came in the office. It's day 3 today. She's been at my house most of the weekend, so we're able to kind of care for her through the weekend. We took the drain out. She really didn't have much draining, so I just took it out the next day.
Yeah.
This is all gonna flatten out, That's the first time you've seen it, right?
Look, it really seen it, yeah.
And
Everything comes down as the swelling goes.
right, exactly. Like, you look very unusual right now, and it looks a little bit pulled right here. But that's just because there's a lot of swelling in that area. We really brought her cheeks up, Joy, but she's so swollen in this area. So far, I'm pleased with Carol's results. She is pretty swollen now. Whenever you go deep like that, I do expect a lot of swelling and long-term swelling.
So the swelling will start going down today.
Really, the proof is in the pudding. I always talk about as they heal, you can see how the swelling goes down, then you can evaluate your work a little bit more with a harsher eye. How's the tightness of that? That's not so bad, is it?
No.
We'll give you some more of these little, it's called Adaptic. It's the cotton strip that's on both sides.
I just want the next 2-3 weeks to go by quick so I can see what it's going to be like.
With all the tension that we had running around the house before the surgery, I didn't want to allude to you how nervous I was about it, because I thought it would just exacerbate your own worries. So I was really scared.
I could tell. I knew you were nervous.
I think we're both lucky to have a good dynamic with our in-laws.
Yeah, yep. We took Carol out for the first time after surgery. It's kind of introducing back into walking and a little bit of hiking. How you doing, Carol?
I'm good.
Not too steep, is it?
It's gorgeous.
I have little cheeks here and they're still swollen, but they will go in.
My mom looks amazing. I mean, she was a beautiful woman before, but Julie's work is just incredible, and I'm really proud of her.
I had thought of how youthful I was going to look, and let me tell you, it's far more than I ever dreamed that they could do. My daughter-in-law is so talented, it's amazing.
Your friend came in the office the other day. Oh. So it was my first referral from you. I am happy with Carol's result. I've had several of her friends call me about future work, and her being who she is in Malibu. There's a lot of business coming this way.
I just love the spirit it brought back to my mother.
This is fun. Gorgeous out there, isn't it?
Especially in light of the fact that she lost her husband last year, and I think that there was a bit of a shadow that followed her around for the last 9 months.
My husband, his desire was that I enjoy the rest of my life, and if he had lived, he would have enjoyed what he sees.
You know, with all of our busy, crazy lives, to take a minute out and just appreciate how blessed we are, it keeps it all in perspective.
It does, doesn't it? Yeah.
I can my face.
When I look in the mirror, I see disappointment. After having 3 kids, breastfeeding them, I just don't look the same as I used to when I was in my 20s. My name is Gina. I'm 33 years old. It's hard to understand and accept what my body has transitioned into. Today I brought my 3 friends with me to help support me while I discuss my pre-op visit with Dr. Edwin. We're all nurses at the local hospital in our area.
You were going with saline implants, I think, right? Okay. Lift your breasts. Let it go. Okay, come on in.
What's up, girl? Let's see. This is 300. Too big.
You don't look huge.
I don't think so. I kind of like the smaller one. It depends on what you want. Either one are good though.
She was vacillating back and forth between too big, too little, too small. You know, should I get a lift, should I not? And she also had so many people influencing her decision.
I think in the middle would be too small.
Hi, I see you brought an entourage. I'm Dr. Edwin.
Hi, I'm Marcy.
Marcy?
Morgan.
I'm Morgan. Oh, okay. Megan, wow. It's very nice to meet you.
I think it looks so good. It doesn't look as bad, or not bad, but it doesn't look as big when you're not lifting it up as much.
Truly, we're lifted like a little bit. Gina had a lot of input, so I think when you have too many people, it gets to be a little confusing. So it was a big ordeal for her to come to the size that she wanted. One of the things that Gina has, her breasts kind of hanging a little bit, and you need to have the proper amount of volume so she gets what we call the projection. If we're doing a formal lift, then we could really tighten up all the skin around it. Or just doing a crescent lift, which is lifting maybe a couple centimeters.
And it wouldn't be better to do more of a lift and make them smaller and put in a smaller implant?
We can do that, but we talked about scars. Scar is a big issue for Gina, and she's not really ready to quite accept the scars that it takes to give her the result that she wants.
The formal lift is just, it's too much scarring.
Yeah, I wouldn't want that either. I think it'll look good.
I would like fuller breasts that are lifted, perky. I want them to be perky again. I am a type A personality. I want perfection. Dr. Edwin's going to do breast augmentation today with a lift. My expectations versus what I'm going to get. I guess it's sometimes like a haircut, you know, you go in with a picture going, I want to look like this, but you come out looking something, you know, a little bit different.
Brad?
Yeah.
Huh?
Do you have any questions at all? I don't.
Not
everything
really.
Good?
It's all in your hands now.
There, this is going to be up a little bit more like that, okay? I will take good care of you, okay? And then when she's done, I'll come out and talk to you. All right.
Okay.
Okay.
We'll see you soon.
Okay, great.
Okay, my new best friend. Sweet dreams. We'll be taking good care of you. You'll be even more beautiful than you already are.
Gina has what we call ptosis, which is where the breasts are droopy. My concern would be is after the surgery, she really wants them lifted up, then we would have to have additional surgery to do a formal breast lift. Okay. So basically all we're now is we're just developing the tracks for the breast implant, just to make sure we got a good pocket. This is the sizer, and we're basically rolling up just like a taco, placing it in there. And this allows us to size appropriately what she wants. And then we just place it in the pocket that we've created.
It's 350.
Okay, this 350 in? That's good. Oh, that's perfect. She looks all right now. She definitely does need the crescent. You know, lift would make her look a lot better because we really want to fill up what her skin envelope is. So that's what I'm looking at right now and assessing how much we actually have to lift in order for her to have the result we had talked about. We're just checking symmetry right now. So it looks pretty good. A crescent lift is basically just taking up a little bit of skin from the top portion of the nipple and just moving up a couple centimeters. I think she did great. We're just going to taper up and we're all set. So, still a work in progress.
I thought you said she was awake.
Tell you how much she put in.
Hi, Gina. It's your doctor. Oh, that's okay. How are you feeling?
It's a lot more painful really bad.
Where are you feeling the pain?
My arms. I want to see them.
Huh? You want to see him? You'll see him tomorrow.
Oh, God.
Just don't move.
Looks good.
It's really strange because she's pretty much the tough one. She's the one that's usually got it together all the time and keeping everything under control. So putting her in that kind of state is kind of confusing because I'm not used to seeing it. So that's why I want her to come around as soon as possible, and then I'll get her home.
It's been about 24 hours since my surgery. I'm about ready to see my breasts for the first time.
Okay, we're gonna cut your dressing off and put you in a bra.
I think I had a little bit more pain than I had anticipated. They make my arms look smaller. Aside from, the pressure and the throbbing pain, the nausea probably is getting to me the most.
She's hanging in there, but, I wish the pain would calm down a little bit.
Hi. How are you feeling? Hi guys, how are you?
Good.
I'm gonna have you hold on to
And why couldn't you lay flat?
Hang on to the front.
It just was too uncomfortable.
This dressing mushes and squishes your breasts, so they're sort of flattened out. This isn't what they're gonna look like in the next couple days. They'll start to take on the breast-like shape, okay? Okay. So you can't judge everything right now.
I'm going to have you lean against this chair, actually, because it'll be more comfortable that way. And I'm going to push a little bit on this. Okay. What do you think of the size? I guess you can't really tell right now.
Actually, they feel heavy.
It'll feel better with the bra
I
on.
want to support it, yeah.
Brad,
Yeah, I like
size-wise?
it just, when she's in pain, it just bothers me a little bit.
This is what your biggest concern with, is this flatness that you had right here.
Yeah.
Everything just kind of has to rotate right now.
I want this one to fall a little, but it will eventually. I just want them to, I don't want to, and they still haven't, and they're still not.
Natural curve.
They're not too, well,
Hopefully they don't drop any more than that.
They're not going to. They're not going to drop anymore. It's just going to basically rotate into more of a natural shape.
How long does she have to wait till she can have fun?
She should wait
Brad's
maybe about
number
10
one
days.
question.
10 days would be good. Look at she's shaking.
She's
like, leave me alone.
How about I have Gina answer that question?
Sit down. Go sit down in the back. Go sit down in the back.
Unfortunately, it's going to take 2 surgeries to accomplish what I want, but I think that I understand a little better what it is I want.
Just some time to think about it.